So it's products like Maven Clinic that enabled us to be home with our families on lockdown for almost 2 years. What's it like to be here in person, networking with entrepreneurs, CEOs, bankers for the first time?
Yeah, thanks so much. Well, it's amazing to be here sitting with you and in the California sun. So it's really inspiring to be back, but I think everyone must kind of miss their family a little because we're all showing each other pictures of our kids right now. I had a kid during the pandemic, so I have a new baby to show pictures of. But no, it's really great, and we just started, so we're here for the next few days.
So speaking of that, childbirth is the most commonly used service in our country, and yet for so many years we haven't invested in it. How is Maven Clinic trying to change that?
Yeah, I think one of the biggest things in healthcare that has never really made sense is if women and families are kind of at the center. Childbirth accounts for 1 out of 4 hospitalizations in the U.S. It accounts for some of the top, one of the biggest life transforming moments in starting a family and in healthcare, that women and families have never really been at the center of it. And a lot of the care models, they don't include things like mental health or breastfeeding support or pediatric support, all kind of, in one journey and on one platform. And so what Maven's trying to do is really redefine how we think about women's and family health care by adding a lot of these more holistic providers into the care model, and then even areas like fertility, miscarriage, postpartum depression, bringing that to the fore.
We just heard Goldman Dandies there talk about how it is a war for talent, and now with people sort of reevaluating their future, where they really want to be, more so now probably than ever. Do you see adding on some of these top tier family benefits? Could that be, kind of where employees draw the line when they make a decision about what they want to do or not? Could it make employers significantly more competitive?
Absolutely. I think we're living through the Great Resignation right now, and so family benefits has been really top of mind. It's been an area that's been underserved for a while, but we've seen an explosion in interest in fertility benefits over the past year, fertility, adoption, surrogacy, and then really kind of bringing new moms back to work, which has always been kind of core in what we do. So many women left the workforce in the last few years that a lot of employers are really focused on that as well.
So many women are also scared to have a baby at work. And I wonder how your platform and these benefits being offered could change that.
Yeah, there's been a lot of people are afraid right now because of vaccine misinformation about things like fertility. Do you start a family now if you're pregnant? So I think that's definitely, we've done a ton of education around that over the last few years with our clients. But I think that coming back to this idea that family is just so important, as we've all been kind of locked in our homes for the last 2 years with each other, I do think we're seeing a baby boom. If there was kind of about a 10 to 15% dip in pregnancies last year, a lot of it's coming back online right now, and fertility as well.
Interesting, because I feel like if you look at the broader stats, the birth rate is actually going down. Is it not?
It was over the last few years, but a lot of people were delaying things. And so now I think what we're hearing from our clients and some of our health plan clients as well that sit on top of all these claims is that things are incredibly busy. And so a lot of those delays they're seeing this year.
So what does that mean in terms of our needs for healthcare, and how will Maven try to meet those needs?
I think it just means that, I think what digital health has done with COVID is it's really shown a new way of delivering more kind of culturally sensitive and holistic care to serve more people. And so I think that, particularly with telemedicine, which is core to Maven's care model and what we do, we're able to reach more people, give them more support, and I think, really helping in this family building journey.
How receptive do you feel mostly male venture capitalists are today to what you're trying to build? Given that for so many years, and it's still happening, women have had trouble getting investments in women and children.
I think it's changed a lot. We have a board of predominantly women, and even in our last fundraise, we just raised $115 million. That was co-led by a female venture capitalist. I think, more generally though, digital health is like going through a huge boom. I think a lot of investors are saying, oh, it's like where fintech was in 2013. And so women control 80% of healthcare decisions. It's like retail. Like if you don't invest in women's and family health, then you're actually not investing in the core consumer at all.
I'm sure you have a position on the Texas abortion law. Thoughts?
Yeah, I think that is, as ACOG and a lot of the medical associations have said, that's doing harm to patients because it's restricting access to care. And so, really proud that our telemedicine platform is able to help people kind of think through a lot of decisions they have to make right now.
So given the political landscape, how important is it for women to have more choices at their fingertips when it comes to their health and their bodies? And how do you see Maven fitting into that?
Well, everything is about access, in my opinion, and Maven, that's our mission, is access for all. And access is not just, it's to in-person providers, but it's also to providers that you trust, who look like you, or, who share who speak your same language, or who are your same race, your same gender. I think that's one of the most powerful things that telemedicine and our platform is doing, is we're connecting patients to providers that they trust, who look like them and share their lived experience, and that and over virtual platforms, so they can talk to people 24/7. And so that is really empowering for patients around figuring out what to do with their health.